LeBlanc, professor in the Department of Population Medicine and director of Dairy at Guelph. Dairy at Guelph is a network of over 60 faculty and 125 graduate students and postdocs who are active in conducting research across disciplines in support of dairy production and dairy foods. We want to thank and welcome the hundreds of participants joining us for today's webinar from around the world. Whether you're a dairy farmer, an advisor, working in industry, or in academia, we hope that today's research showcase will provide you with food for thought and opportunities for action. The University of Guelph is Canada's dairy university. We have a long history of research, connections, and outreach to industry. We strive to conduct relevant and rigorous research and get results into the hands of dairy farmers and their advisors. Today's speakers are active members of the Dairy at Guelph team who are contributing to advancing dairy research and progress in our industry. I want to thank Dr. Mike Steele and the students in his advanced dairy management class for the substantial time, effort, and planning that they've gone into putting together today's webinar. Finally, I want to assure you that we will ensure that Dr. Steele is aware that the popularity and excellent response of today's webinar is attributable to the quality of the program and the speakers, and not to his personal charm and good looks. Enjoy the event.
Hi, everyone, and welcome to our webinar. My name is Sabina Zakor, and I'm a current master's student here at the University of Guelph, studying dairy cattle nutrition under Dr. Trevor DeVries. As some of you are aware, the students enrolled in the Advanced Dairy Management course last year presented the first webinar of this series, titled A Fresh Start, Transition Cow Trifecta, discussing research surrounding the nutrition, health, and reproduction of dairy cows during their transition period. Following the trifecta theme, which defines a run of 3 wins, our class decided to focus this year's webinar on calf management and the current research being done to improve what we believe to be the top contributing factors to their success: nutrition, welfare, and health. Here at the University of Guelph, we're so lucky to have numerous world experts and their students conducting leading edge calf research. So I hope you're as excited as I am to learn something new today. Regarding our agenda, we'll start shortly with presentations from each of our speakers. Starting us off is Dr. Michael Steele, who teaches courses covering dairy cattle nutrition, management, and physiology. Next, we have Dr. Charlotte Winder, who will introduce some of her research addressing hot topics in calf welfare research, such as disc bedding methods, ways to promote wound healing, and the role of pain management on farm. Lastly, we have the pleasure of listening to Dr. David Renaud. He is a veterinary epidemiologist currently focusing on improving the health and welfare of calves in the dairy and veal industries through research assessing the risk factors of disease and mortality. Following our 3 speakers, at approximately 12 p.m., my classmate Hannah McCarthy will be leading an interactive discussion with all 3 researchers to answer any questions you may have. Although so many folks have already provided questions upon registration, which is awesome, feel free to keep adding them to the chat during the webinar. Stay tuned in to the end of the discussion as well for the chance to win some fun prizes from our draw. But before we get started, I'd like to thank both our knowledgeable speakers and all the members of the Advanced Dairy Management class for planning, organizing, and implementing this event. If it wasn't for everyone's continued support and teamwork, a webinar of this scope definitely would have not been possible. So without further ado, I'd like to pass it on to Dr. Mike Steele, who will start off our calf trifecta. Enjoy.
Thanks for the introduction, Sabina, and thanks to everyone for attending the calf trifecta. So my name is Michael Steele, and my lab studies early life nutritional programming. So we like to think of a calf as a ball rolling down the hill, and depending on how you feed it will impact its future direction and its overall physiology and metabolism. So I'm going to give you a very personal example. So not many people know this about me, but I actually had a twin brother. We were pretty cute, as you can see, but we were separated at birth, and I was fed 4 liters of colostrum, and this impacted my future physiology. So I have a higher body condition score. I have, pretty good temperament, moderate IQ, but I'm obsessed with calf nutrition. So my twin brother, not many people know this, was only consumed 2 liters of colostrum. And the person that is my twin brother is Dr. David Renaud. And this affected his future physiology. He has a lower body condition score. He might come across very calm during his presentation today, but he's actually got poor temperament. He has a high IQ, higher than me, I will admit that, but he's interested in calf health. So this is a very personal example, but what you're seeing in the dairy industry are these relationships between improving average daily gain or health during the pre-weaning period and lifetime performance. So we need to be aware of this relationship. It all starts with colostrum feeding though. So firstly, the cleanliness of this. So making sure that everything you're using to feed this animal, especially with maternal colostrum, is really clean. Same with dried colostrum sources. You might want to even consider pasteurization as well. These are the things that you need to take a look at. Make sure that you have a clean source being fed to these animals. Brix of over 22, striving for 60 gram per liter IgG colostrum. So make sure that you know how much you're feeding and the quality. With respect to quantity, you're striving for over 10% of their birth body weight in the first 12 hours. So a 40 kilogram calf, you want to consume, you want to feed it at least, I'm saying at least, if you can feed more, please do, 4 liters of really high quality colostrum. And feed a second meal at that 12-hour if you can, of really high quality colostrum, because I think you can boost IgG quite a bit with that. Also the quickness, if you're delaying colostrum feeding, you're just going to be docking down serum IgG in your calves. So if you can do it in the first hour, I think that's the best way. So there's lots of things within colostrum. Obviously, we always focus on immunoglobulins, but what our lab is striving to do is kind of break this open more. And we're studying the oligosaccharides, which are essentially prebiotics that are at high levels in colostrum. We're studying the fatty acid profiles, which are really unique. We're studying insulin as well. So we want to know what these other bioactive factors are doing. But right now on farm, we're just assessing immunoglobulins. So we use that with serum total protein estimations. And, back in the day, we were striving for greater than 5.2 grams per deciliter, but now you see some herds even going for 6 grams per deciliter. I just wanted to note one study that we just published in the Journal of Dairy Science, comparing calves fed maternal colostrum versus a colostrum replacer. I just want to say, when you're using serum total protein, it's accurate when you're assessing calves that were fed maternal colostrum. As you can see, very few calves were inaccurately characterized with failures in this study when you're using a serum total protein indicator with maternal colostrum. But colostrum replacer, there wasn't a good relationship here in it. There was a lot of misdiagnosing of failed passive transfer here. So you need to keep your eye on this, and I don't think it's accurate. So if you're feeding colostrum replacer, do not use serum total protein as your estimation. I would send it away from our lab to do IgG, is the take-home message here, because STP is not accurate tool to predict passive transfer in colostrum replacer fed calves. Another thing that I see on farms is sampling calves once a week. And I have some issue with that, because I think we're, again, not being very accurate assessing passive transfer that way. I think that we should be sampling between 24 hours and 3 days of life. That's the window you want to collect your serum sample to assess for serum IgG or serum total protein. Because after that, the decay is just too strong. And this is something that we need to adapt to. So, making sure that we sample in the first 1 to 3 days, because our standards are going up. A recent paper by Lombard has really been pushing our standards for, striving for a really high serum IgG, so greater than 25 gram per liter, which I think is an awesome idea. Truly think that this is the direction we should be moving into. I'm going to show you some evidence why, though. Now, this is a study that was done at Walker Dairy in Ontario, Canada, by my PhD student, Alberto Lopez, and he fed different levels, so a 30 gram, 60 gram, and a 90 gram per liter IgG maternal colostrum. And as you can see, and once you feed that, you steadily increase your serum IgG. And actually the AEAs in the study were the same, which is really interesting, because 90 gram per liter, you're offering over 300 grams of IgG to all these calves. So that's a lot higher than our 150 gram to 200 gram recommendation, which further supports we should be feeding a lot more colostrum. But anyways, the question we get from farmers is that, okay, I've only have a 30 gram per liter maternal. What do I do? Can I enrich it with a dried colostrum source? So that's what we did. We took that 30 gram, we enriched it with a dried colostrum source, and we bumped it up to 30 gram per liter. And yes, it can boost serum IgG from 11.76 to 19.85. However, when you boost the 60 gram per liter to a 90 gram per liter using the same dried colostrum source, I think the osmoles were too high, and you don't have a really great result here. A little bit of a boost, but really not that different. So the take-home message here is if you got low-quality colostrum and you want to feed it in that first or second meal, you can boost it, okay, using a dry colostrum source to improve serum IgG in calves. Another thing that our lab has been studying related to colostrum is extending colostrum feeding. So this is the idea that, we should have a transition from colostrum to feeding milk. And we've been doing 50% colostrum, 50% milk mixtures for the first 2 to 3 days. And we noted that this increases intestinal development, increases IgG after 12 hours of life, and also reduces the risk of mortality. We've also looked at extending it for 2 to 14 days. So that's 10% colostrum replacer, 90% milk replacer in these scenarios, and it increases body weight, average daily gain, and also reduces the risk of mortality. So we call this style of feeding post-A1 supplementation of colostrum, or another term that you hear in the industry is phase feeding. And I think that this is a really interesting concept to feed animals differently in the first week or two of life before they go purely onto a milk and concentrate diet. So let's switch to milk feeding. I'm not going to talk much about, high-low milk feeding. I think that we've debated this enough. The only point I want to make is that if you're not feeding high levels of milk in the first 4 weeks of life, you're going to be missing out on growth, okay? Any way you cut it, if you're not feeding them milk or more milk during a time when they don't consume enough starter to grow at high rates, you're going to be depressing their overall growth, especially in those 4 weeks of life. In this study, they went to group housing at week 3, 4. These lows caught up with respect to average daily gain, but the first 4 weeks of life, you're never going to capture that again. What our lab is studying mainly right now with milk feeding is comparing whole milk versus milk replacer and different milk replacer formulations. First and foremost, I want to say that I think milk replacer is a really good tool on many farms. I'm not against milk replacer. I just have questions with respect to some formulations, not all formulations, but some formulations, and mainly the ones that are higher in lactose and lower in fat. And my concerns are from a gut health standpoint. You have higher osmoles and hypertonic milk replacers, increase gut permeability. These high osmoles are predominantly coming from the lactose as well as the ash. I also have concerns metabolically because high lactose milk replacers decrease insulin sensitivity, at least in the first weeks of life, but we really don't know the long-term consequences of this. So I'm going to show you one study published by my PhD student, Juanita Echeverria Manera, and she compared a high fat milk replacer, so 26% fat, versus a high lactose. So basically substituting that fat for a high lactose, and that's around 46% of the formula being lactose. And as you can see, high lactose calves actually consume more milk replacer. There's no difference in starter intake, and these were all ad libitum fed. So they switched to an ad libitum feeding program at the second week of life on automated feeders. And then they were stepped down at 6 weeks of life to 6 liters from the ad lib, and then permanently weaned at 9 weeks here. What was amazing is that their energy intake was the same though. So even though you have a higher density, high fat, which knocks down their overall intake, their ME intake was the same in the study. What was really amazing was looking at their growth rates. So their body weights were really high. So you're looking at, it doesn't take them that long to get to 100 kilos when you're feeding them this way. But there's no differences between treatments, which was really interesting. It reflects their ME intake, in my opinion. But what I want everyone to note is these average daily gains, especially when they're on the automated feeder ad libitum. You can get average daily gains up to 1.2 kilograms, and we don't really talk about these really high growth rates enough. You can see how that step down from ad lib to 6 liters really knocks down their overall growth, but still 600 grams is still quite high compared to most studies published in Journal of Dairy Science. But what's remarkable is when you're feeding all this milk, you can still have great weanings. As you can see, their average daily gains are over 1 kilo. So this is what's, I want to just take home message here is that regardless of formula, you can still have really great weaning success even with ad libitum feeding of milk. So I want to just touch upon some concepts of weaning before I sign off here. And this is something that our lab studies, especially ruminal and intestinal development in great detail. But I want to say here is that when you feed higher levels of milk, And this is an experiment done by my PhD student, Yolette Van Nykerk, where she fed more milk and then she stepped them down abruptly over 1 week and early. They were weaned at 6 weeks. They just cannot consume enough starter at this point to have this ME intake equivalent to what it was at pre-weaning. It took them all the way up to week 12 of life to actually get there in this experiment. So they don't grow very well. They're more susceptible to disease if you don't have a really good step down. So the take-home message is here, if you have an ad libitum or a high milk feeding program, you definitely should be considering group housing. You should be pairing your animals too so they can learn from each other to consume starter. You should be weaning after 8 weeks of life. No time before. It has to be after 8 weeks of life if you're feeding more milk. Your step down protocols should be greater than 2 weeks with multiple steps. Even with manual feeding, I think you can do multiple steps. And you should be feeding a really high concentrate diet, but just keep your eye on the starch and try to keep it below 30%. These are some of the take-home messages from a wide variety of studies that our lab has done over the last 4 or 5 years in this area. But this high concentrate diet feeding, I just want to make sure everyone's aware that the rumen at this size is really small. It's basically the size of a basketball at 6 to 8 weeks. And if you just fill it with hay, it's going to depress their overall intake. You have to feed it with concentrate so they get the energy they need to grow during this time. And this is where the dry TMRs are taking off, at least in Canada, where we're feeding these high concentrate diets with either a dried straw or a dry hay as well, just for convenience. And this is what they look like. The one right below me here is an 85% concentrate diet. And yeah, you have lots of protein, I think enough starch in this diet. And this is something I would be feeding for the first 1 to 2 months post-weaning and then transitioning them to more higher forage diets thereafter based on some research that our lab has accumulated over the last 5 years. So with that, I want to thank all my students, Yolette Van Nykerk, Alberto Lopez, Juanita Echeverria-Manera, Amanda Fisher-Chalustos, and all the funders for allowing us to do this research. We're really excited about where this is going. Thanks so much again for coming. And I'm going to pass it quickly to Dr. Charlotte Winder from OVC. So take it away, Charlotte.
Thanks, Mike. So I'm going to talk about pain mitigation in dairy calves. I'm going to start by talking a bit about what pain is, what we know about the subjective experience of pain, and then I'm going to talk about a few different procedures or conditions that calves may experience that can cause pain, and what we know about how best to mitigate it. So pain is multidimensional. And so sometimes it's as simple as we have a sensation and experience a response. So we might put our hand on a hot stove and have an immediate avoidance reaction. But especially for pain that occurs in a longer period of time, our subjective interpretation of pain is really important. And this has been shown in a lot of human research, that our cognition and our emotional state influence how we perceive pain. And this has also been shown in animals. And I'm going to talk a bit about that when I introduce some current research that one of my grad students just completed. So we're going to talk a little bit about acute pain versus some kind of longer term inflammatory pain. So acute pain usually is something that's pretty evident. And so this person is either likely experiencing acute pain or is perhaps really good at mimicking behavioral signs of acute pain. And similar in animals, when calves are experiencing acute pain, there's usually pretty dramatic behavioral signs that we can observe. However, if I was going to ask you, is there anyone in this photo that's experiencing pain? It's much more difficult, right? And so people that are experiencing more chronic forms of pain or inflammatory pain, neuropathic pain, don't necessarily have really dramatic behavioral signs. And similarly in calves, we can kind of suss these out from a research standpoint, but from a day-to-day handling calves perspective, we may not appreciate those indicators of pain. So typically the procedures and conditions that calves may experience that cause pain also cause inflammation. And inflammation is a normal response to tissue insult or injury. It's a useful response that helps to aid healing, but we can have excessive inflammation. Inflammation also acts to do things like suppress appetite, which is not something that we want in young dairy calves. and also causes some negative changes with regards to affective state. So we see more behavioral indicators of pain, so things specific to the actual injury, and less indicators of positive affective state, so positive emotional responses. So things like play are decreased in animals that are experiencing pain. So I'm going to talk about a few different procedures and conditions where calves may experience pain, starting at birth. And so there was a really interesting study done a few years ago at the OVC where they were actually aiming to look at pre-weaned calves and look for pneumonia. So definitely not looking at anything around birth. So here they were surveying a group of heifer calves still on milk and ultrasounding lungs to look for signs of pneumonia. But incidentally, they found that in that group of calves, 7% had healed rib fractures. And so I think this is something that's probably underappreciated for sure by veterinarians, by producers, because these rib fractures aren't evident clinically. So if we put our hands on the calves, we're not going to be able to see them, but they were there and they did find them in that study. And I think that lends more credence too behind the results found by an earlier study by Murray et al., where they found that calves born to dystocias, so anything born from a hard pull, benefited from getting an NSAID at birth. And perhaps that's because some of those calves do have injuries from birth, like bruising or potentially even rib fractures. And they found positive results where calves given an NSAID, if they were born to a dystocia, compared to calves not getting an NSAID, had better suckle responses, were more vigorous, and gained better weight. So we're going to go into a couple different procedures. So first one is extra teat removal, which for sure is a common procedure that's done, necessary to be done in order for animals to be milked appropriately, depending on where their extra teat placements are. And even though this is a really small scale cutaneous surgery, there's been research showing that animals do benefit from getting a local anesthetic and an NSAID for teat removal. It can also make the procedure a lot easier. Certainly we have to restrain calves in order to inject lidocaine, and you have to restrain them if you weren't going to use lidocaine either. But it makes it a little bit easier because even if a calf is struggling a little bit, getting a little tiny bit of lidocaine in there isn't too much trouble. And then if they're frozen, it makes it much easier to for sure remove the correct teat and also, get a nice clean cut that's cosmetic and effective. And typically these calves are going to be getting their teats removed at the time of disbudding. So an NSAID can be given for both at the same time. So I'll just give a little bit of a summary of the research around pain control for disbudding. So local anesthetics have been shown to be beneficial for all forms of disbudding. So certainly cautery disbudding, where again, it's really obvious here that it mitigates the acute pain. You can see the calf on the left that had lidocaine, maybe calves react a little bit to being halter tied, but nowhere near the behavioral response of the calf on the right that is being disbudded without a local anesthetic. When we look at caustic paste, the results are really clear. However, clinically, depending on how the paste is being applied and how long you stick around after giving caustic paste, it might not be appreciated because it does take time for that caustic paste to cause a burn. And so depending on how it's applied, it can take up to 30 minutes. And so these videos are from a study that we did a few years ago now. And the calf on the left received an NSAID, but no local anesthetic. And the one on the right received both. And you can see similar to the calf undergoing cautery, we see head shaking, head rubbing, ear flicking, vocalization, behavioral indicators of pain. And this has been shown in calves of different ages as well. We had a study looking specifically at calves under 5 days of age. This is a calf that's less than 24 hours old, undergoing caustic paste disbedding with no local anesthetic. And the behavioral responses might not be as dramatic in terms of, getting up and down, scratching their head. But still, even in young calves, it's clear that they have these behavioral indicators of pain like head shaking that don't occur when we give them a local anesthetic. So lots of research for local anesthetics, lots of research for NSAIDs, both useful for all different methods of disbudding. But one medication that is commonly recommended by industry and vet organizations is sedation. And I just wanted to make a note on this because sedation is a bit interesting in that there really isn't a plethora of research in that area. There's very few studies, and the ones that have been done, including one from our group, show mixed results. And so I think as a result, it's important that a decision around sedation be done in consultation with your veterinarian. So sedation can have benefits in terms of making calves easier to handle. Some research has shown that it may reduce behavioral indicators of pain. It's important that sedation is always given with a local anesthetic and an NSAID too, because it's not effective on its own to mitigate pain. But potentially there are some things to be cautious with sedation. It has a narrower safety margin, so overdosing calves is possible. It has been shown to kind of have a bit of a hangover effect after being given. And so again, I think this is a medication where I wouldn't say from my perspective it should be something recommended to all farms. It's something that, you know, can be used on some farms with benefit, but should be discussed with your veterinarian. Age at disbudding is another thing that is typically recommended, you know, with a real line in the sand by different organizations. And I mean, sometimes we need to have lines in the sand, but I'm going to share some research around this. So yeah, lots of different organizations and industry groups have age recommendations. But what does the research say? And this is similar to sedation. There's really very little research comparing different ages at disbudding. And so again, I think my recommendation would be that the farm works with their veterinarian to determine the age that's appropriate for that farm. This study done a few years ago by a group at UC Davis in California, it's really interesting. They directly compared calves disbudded at 3 days to calves disbudded at 35 days. And the take home here essentially is that there were no major differences in the majority of their outcomes. So it wasn't really clear that one was better than the other. There was one outcome, though, that is in the graph here that was really interesting. This was pain sensitivity on the flank, and this is up to 60 days after disbudding. And so the idea here is that if we perform these procedures early in life, do we sensitize calves to pain and make them more sensitive to pain when they're older? And again, this is just one study and just one outcome, but the results from this study suggested that calves done at an earlier age, so the ones done at 3 days, were actually more sensitive to pain on their flank later in life, later in the pre-wean period, compared to calves disbudded at a slightly older age. So again, it's only one study, doesn't mean for sure that early is bad or anything like that. But I think the take home here is that there's probably other farm specific factors that are more important. So things like health status of the calves, maybe one farm struggles with some health issues early in life, where another one calves do really well for the first 4 weeks and maybe are have a little bit of pneumonia later on. And so again, this is why it's really important to work with your vet to determine, you know, when is the best time on my farm to disbud calves, with the goal of giving them at least 2 weeks before weaning so they can heal, but doing them at a time where they're healthy. The last study I'm going to share here is one done by my former PhD student, Cassandra Reedman. And so she looked here at nutritional and pain after disbudding. So all the calves in this study got a local anesthetic and they got an NSAID, but the difference with the two groups was how much milk they got. And so because it was an experimental study, we fed them on a calf rail. So intakes are not quite as high as many farms are doing, but our limited plain here, the LP group on the bottom, all the calves went onto the feeder at about day 4, and our limited plain calves were restricted to 5 liters a day and then slowly weaned. And our biologically normal calves were offered more milk. Again, because it was a research setting, we had lots of people in and out of our calf pens. They didn't drink as much. I mean, some individual calves may have drank 15 liters, but on average they drank, got up to just around over 10. So this was our difference between our groups. And certainly, you know, farms can achieve higher intakes than this, but this is a bit of a research setting here. So we have our two groups with 2 different nutritional planes. And the other thing I just will mention too is that for sure the lower plane calves did eat a little bit more starter, but total caloric intake was different between the groups. So certainly our calves up here consume more calories over the whole pre-weaning period. So what did we find? So we found that calves on that elevated nutritional plane healed faster. So their wounds healed much faster after disbudding, and they had better pain outcomes. And this included pain outcomes in the weeks following disbudding. So they were less sensitive around their horn bud, and they healed those wounds much faster. And so I think this is a really interesting tie-in to the other topics that we're talking about today, in that some of our management practices that we do that might have impacts on health and performance may also have great impacts on welfare. And so for sure, maybe it's important that we give specific pain control drugs to calves around different procedures and conditions. But also I think this kind of opens a little bit more light on kind of how everything that we do to our calves is going to impact their experience. And when we think about things like the subjective nature of pain, calves that are having their nutritional needs met are likely going to have a better experience around those stressful events that may occur compared to calves that are more stressed nutritionally. So with that, I'm going to hand it over to my colleague, Dr. David Renaud. He's an assistant professor in the Department of Population Medicine. So Dave, the floor is yours.
Thanks, Charlotte, for the kind introduction. Really happy to be here today to present some of the new research that we've done here at the University of Guelph. Specifically, over the next 15 minutes, we're going to talk about some stuff on diarrhea. What's the impact of diarrhea, both short-term and long-term? How does diarrhea develop? How do we prevent it? And ultimately, how do we treat it without using antimicrobials? So where we'll start our journey is talking about impact. And this is a study that we recently published in the Journal of Dairy Science, one of my master's students, Matthew Shinwald, which was from a database that was developed at Mapleview Agri, which is a research facility located just outside of Guelph. Their technicians fecal scored calves on a daily basis for 28 consecutive days, and we had almost 3,000 calves within the data set. Specifically, what they're looking for is they're looking at a fecal score of 0 and 1, which are considered to be normal fecal scores, and then looking at a fecal score of 2 or fecal score of 3, which is considered to be abnormal. So we had loose manure and very watery manure. And that's what we consider to be kind of our group that we're going to examine and evaluate. And what we specifically evaluated was looked at the impact of having an abnormal fecal score or having diarrhea on mortality, antibiotic treatment, and also looking at growth. What we found, some of these initial findings are not super unsurprising. And I'll just orient you on this graph because all the other ones are very similar after this one. So we have the portion of calves that are not treated for diarrhea with an antimicrobial. And then we have the days after they arrived to the facility here down here. The calves in that dark blue line had no days with diarrhea. Then we have 0.5 to 1.5 days with diarrhea, 1.5 to 4 days with diarrhea, 4.5 to 6.5 days with diarrhea. And then we have greater than 6.5 days with diarrhea. And what we found in this study was that if calves had more than 6.5 days with diarrhea, they were much more likely to be treated with an antimicrobial compared to those that did not have any diarrhea at all. So really an unsurprising finding when you think about it. What we also found is that calves with more days with diarrhea had a greater risk for mortality. So if you compare to this blue line at the top, which is no days with diarrhea compared to all the other groups, they had a much lower rate of mortality compared to the other groups, especially these calves that had more than 6.5 days with diarrhea. We also looked at growth, where body weight was taken at 14 days after arrival, 56 days after arrival, and 77 days after arrival. And what we found was at the end of the 77 days, calves that had more than 6.5 days with diarrhea were about 15 kilograms lighter than calves that had 0 days with diarrhea. Similarly, if you look at 4 to 6.5 days with diarrhea, they're about 10 kilograms lighter than calves that had no days with diarrhea. So clearly that as the number of days with diarrhea increases, the impact on growth also increases and has a very substantial impact. A really interesting finding that we had in this study was when we looked at respiratory disease or antibiotic treatment for respiratory disease. And the calves that had no diarrhea at all, they had the least amount of respiratory disease compared to the other groups. And the calves that had the greatest number of days with an abnormal fecal score or number of days with diarrhea had the greatest level of respiratory disease. And likely that's related to an impact on immunity or immune function, where when calves have diarrhea, it's going to cripple or impact the calves' immunity or immune system. So when calves have more diarrhea, they're going to potentially develop more respiratory disease. So that's the impact short term. We have an increased level of mortality, we have increased antibiotic treatment or antibiotic use, and we have a reduction in the level of growth when we look at the pre-wean period. But when we look at a little bit longer term impact, these effects really do remain for the rest of their life. And this is a study that was done at Michigan State, where they followed 2,200 calves through to the end of their first lactation at a single large dairy farm. And what they found, similar to us, was that calves that were treated for diarrhea in the pre-wean period had a reduction in average daily gain. Also, what they found was that at the end of the first lactation, calves that were treated for diarrhea in the pre-wean period had a 325 kilogram reduction in milk production. So pretty substantial impact on milk. Also, animals that had diarrhea in the pre-wean period had a 5% reduction in conception rate as heifers. So clearly it's not just those short-term impacts, but also these long-term impacts that really impact the productivity and economics of the dairy herd. So we really need to think about preventing diarrhea. In order to think about preventing diarrhea, we need to think about how does it actually develop. Traditionally, we thought if we have exposure to pathogens, we're going to have development of diarrhea. And this is just a graphic kind of highlighting that. So we have rotavirus and coronavirus and Cryptosporidium parvum. The calf ingests it. It goes to the intestine and has an effect. For rota and coronavirus, what happens is we have these little finger-like projections that are in the intestine. And if we have rota and coronavirus, they basically will all cripple up or get destroyed. So there's no absorption of any fluids or any nutrients that are going through the small intestine. Similarly, for Cryptosporidium parvum, it also has a similar effect. For E. coli will actually attach to these finger-like projections and will cause the secretion of fluid into the intestine, causing diarrhea to get worse. But so that's how the mode of action of these actually happens. So the attachment and really destruction of the underlying architecture in the intestine. But for diarrhea to occur, it's not simply exposure to those rota, coronavirus, Cryptosporidium, or E. coli. It's much more complicated than that. And this is a study we did a few years ago where we took fecal samples from calves that had diarrhea and those that were healthy. And then we looked at the prevalence or occurrence of Cryptosporidium, rotavirus, and coronavirus. And what we found in this study, which I think is quite interesting, is that in the diuretic calves, so calves that had diarrhea, they did have higher levels of different pathogens like Cryptosporidium rotavirus. But in calves that were totally healthy, they also were shedding these pathogens as well. So again, it's just not the simple exposure to these pathogens that causes diarrhea. To explore this a little bit more, myself and one of my colleagues from the Ontario Veterinary College, Diego Gomez, took some fecal samples from calves that were healthy and calves that either had acute, so rapid onset of diarrhea, or had diarrhea for a few days. And what we did was we compared the bacterial species that were present in the feces of those calves. And what was interesting is when we compared the two, those healthy calves to those that had diarrhea, we found some interesting differences. Specifically, calves that were healthy, so a normal fecal consistency, had an increase in the level of diversity and also increase in the amount of richness of different bacteria that were present in the gastrointestinal tract compared to those with diarrhea. And all of this suggests that if we have more good bacteria, if we have more diversity, more richness in bacteria, potentially that can protect the gastrointestinal tract against those pathogens like rotavirus, coronavirus, cryptosporidium, as well as Salmonella and E. coli. So that's the part on fecal microbiota and the impact that that can have on the development of diarrhea. Other things that can influence the development of diarrhea is stress. And one of the things that we've recently studied here at the university is looking at the impact of transportation stress. As many of you know, when you send off your surplus calves, your male calves, or your crossbred calves off your dairy farm, they need to be transported to the calf raising facility. And recently we're really interested in looking at what's the impact of doing this in terms of the calf. And there's been some new federal regulations that prohibit the transport of calves for excessive period of time. So it allows for up to 12 hours of continuous transportation. So we're interested in looking at the impact of this type of transportation. So what we did in this study was we went to 5 different commercial dairy farms in southwestern Ontario. We transported these calves either 6, 12, or 16 hours continuously. And then we evaluated these calves at a calf raising facility for 14 days after they're transported. And some of the key findings that we had in relation to diarrhea were that calves that were transported for 16 continuous hours had a higher level of diarrhea when we compared those calves to only being transported for 6 hours. I'm sure you're wondering, how big is the magnitude? Well, if we look at this, the 6-hour group had about 3.5 days with diarrhea, and the 16-hour group had about 4.5 days with diarrhea. So an additional day or 25% more diarrhea in the 16-hour group. So again, I think this speaks to the stress potentially impacting the development of the good bacteria, having rich and diverse bacterial species in the gut, leading to a higher likelihood of diarrhea development. We're also interested in looking at age of transportation, because those are also put into the CFIA regulations. And what we're interested in looking at was calves that were transported less than 9 days of age or 9 days of age or older, and looking at the difference. And what we found was that calves that are transported less than 9 days of age had much greater level of diarrhea compared to those that are more than 9 days of age. So again, when you're thinking about shipping off calves off your farm, it might be an important consideration potentially is looking at the age that you're transporting those calves or sending those calves off your farm. So it's nice and dandy to talk all about the impacts and how it develops, but we need to talk about prevention. How can we set the calf up for success? And like Dr. Steele talked a little bit about previously, was he talked about colostrum management. And colostrum management can have a really big influence on not only having passive immunity and having those protective immunoglobulins present to protect against disease, but it also can influence the development of bacterial species in the gut and ensure that we have increased diversity and richness of bacterial species, further preventing diarrhea. Also, when we're thinking about setting the calf up for success, we need to think about plane of nutrition. Feeding a high plane of milk nutrition is really, really critical, not only to improve growth, feed efficiency, but also to protect against disease. Other considerations are the environment, making sure that we're reducing exposure to certain pathogens like rotavirus, coronavirus, cryptosporidium, Salmonella, and E. coli. We can do that by ensuring that we're cleaning the environment, we're disinfecting between calves, and that will help to prevent exposure to those particular pathogens. Finally, there's some research to point that direct fed microbials or transition milk can be used to also increase the diversity and richness of the gastrointestinal tract bacteria and further protect against disease or diarrhea. So using these 4 steps can go a long way to protect or prevent diarrhea from occurring. The challenge with protecting or preventing diarrhea is that it is never 100%. We're still always going to have additional cases of diarrhea that occur. And really the thinking is, well, I have a case of diarrhea. What do I do now? How do I treat it? Well, treatment is really critical one treatment that's really critical in terms of diarrhea is ensuring that we have enough fluids going into those calves. oral electrolytes are really, really important and critical to preventing against dehydration from developing. But another common treatment that's provided is antimicrobials to these calves. And given the concern about antimicrobial use on farms, the development of antimicrobial resistance, we need to really rethink the use of antimicrobials when we're using it to treat calf diarrhea. And that's why we started thinking about, what if we give colostrum to calves that have diarrhea? Can that actually help to protect against disease? And to explain the study that we recently did, I'll ask my master's student, Javi Carter, to jump on and talk a little bit about the methods of this experiment.
Yeah. Thanks, Dave. Hi, everybody. My name is Javi Carter, and I'm one of Mike Steele and David Renaud's graduate students. So I'm just mixing my treatments here, and I've got one pre-made for after. So we've got 162 grams of milk replacer and 162 grams of colostrum replacer. So we had 3 treatments in this study. We've got one treatment that's just a control, so just regular milk replacer, and then we have 2 other groups. One was a treatment of a 50-50 mix of colostrum and milk replacer for 4 feedings over 2 days, and then the exact same thing for 8 feedings over 4 days. So let's see if we can get this guy to have a little snack. So our calves were enrolled once they visibly had diarrhea, and they were health scored daily for 56 days after enrollment and weighed weekly. Over to you, Dave.
Awesome. Thanks, Javi. Thanks for the insight into the experiment, and we'll talk about some of the results that we found in this experiment. So some of the key findings that we found was that the long-term therapy group really had a big impact in terms of resolution for diarrhea, but also growth. If we first start looking at resolution, calves that had colostrum, so 50% milk replacer, 50% colostrum, for 8 consecutive feedings, resolved their diarrhea a lot sooner. So about 1.6 days sooner compared to the control group that was simply fed milk replacer. And what this graph is trying to show you here is the proportion of calves that have resolved their case of diarrhea. And you can see in the red, the long-term colostrum group resolved a lot quicker compared to the black line, the control group here at the end. What's also interesting is looking at growth. Calves that had the 8-day supplementation of 50% colostrum replacer, 50% milk, gained a lot more. They gained 98 grams per day more than the control group over the 56-day experimental period. And at the end of the experiment, they're about 10 to 15 kilograms heavier compared to the control group. So really, really substantial impacts to providing colostrum, or a small amount of colostrum, in resolving diarrhea, but also potentially getting rid of some of those impacts that we talked about earlier in terms of impacting growth. So with that, I'd like to thank the students that made it possible to do this work. Without students, we would never be able to accomplish what we accomplished here at the university. So I'd like to thank Javi Carter, Matthew Shinwald, and Hannah Getz. And also like to thank all the funding and support that was provided by these funders of this research. With that, I'll throw it over to Hannah. Thanks for listening.
Thanks, Dave. So my name is Hannah. I am a master's student in the Department of Animal Biosciences studying under Dr. Michael Steele, and I'm going to be leading our discussion section today. So thank you to everyone who sent in questions ahead of time, and feel free to continue putting questions into our Q&A function. We are going to try and get through as many questions as possible. So to start us off, could each of you go through some of the main take-home messages from your presentations in about 1 minute or so?
Yeah, sure. I'll get it started, Hannah. But firstly, it's so exciting to see so many people here live. I think it's amazing that we have this kind of interest. And I really want to thank Veal Farmers of Ontario, Dairy Farmers of Ontario, and all the milk boards across Canada for helping us promote all this. But back to your question, Hannah, here's a quick review of my presentation. Firstly, I think we should revisit our recommendations for colostrum feeding. I think that we should be feeding a lot more than what we currently recommend. I think we should have a transition from colostrum to milk. You know, I think feeding higher levels of milk is good under most circumstances. And I think that the formulations of milk replacers should be revisited, and we need to keep our eye on things such as lactose. After that, the weaning is a critical part. And if you're feeding high levels of milk, you have to wean later, have gradual step downs over 2 weeks, and really look into group housing and making sure that we're not underfeeding concentrate during the post-weaning phase. But that's a quick synopsis of and the take-home messages for my presentation. So perhaps I'll pass it to Charlotte to summarize hers.
Thanks, Mike. And yeah, thanks so much for everybody attending today. I'm so happy to be here and be a part of this. Yeah, just some quick summary points from my talk. Certainly, I think, and this maybe answers the question that was in the chat, there are ways for sure we can move away from painful procedures with things like using pole genetics. But for sure, there's always going to be, something that causes pain, whether it's a procedure or a condition that a calf experiences. And certainly from the research around disbudding, around supernumerary teat removal, issues with dystocia at birth, there are clear benefits to giving pain control from a welfare standpoint. And I think it also benefits other people too. I think it benefits the people that work with them, because certainly it's a lot more pleasant to be working with calves and doing things when calves are more compliant and we know we're not causing additional pain. And ultimately too for consumers and from an industry sustainability standpoint. So certainly with disbudding and teat removal, there are clear benefits to using a local anesthetic and an NSAID. And with disbudding, there's a huge plethora of research in that area for both cautery and caustic paste. Sedation appears to be a lot more kind of mixed in terms of results. There can be some benefits, not a whole lot of research. Potentially there are some side effects that are, not to say that they're concerning for everybody, but sedation, I guess we don't know enough about to say that, everybody should be using it or not using it. I think certainly it's something that is going to be maybe beneficial for some people and maybe not appropriate for others. And so something to talk to your vet about whether, it fits with your protocol or not. And similar with age at disbudding, we definitely don't want to, as Dave and Mike had just mentioned, there's lots of different aspects of the way calves flow through our systems that may be stressful, whether it's a step down near weaning, whether it's, a disease challenge that a certain farm is going through. And so kind of removing disbudding from that is useful. So making sure it's done at least 2 weeks before weaning, doing it at a time when calves are healthy otherwise. But to say, doing it at 3 days is better than 30 days, is better than 50 days, there's really not a lot of evidence for that. So again, something that's, I think, an individual farm decision. And then lastly, just I think the piece on the milk allowance and wound healing, I think is really interesting and kind of ties in the fact that, everything that we're doing with our calves is impacting their experience. And I think it's a real positive that we can be doing things that benefit calf health, growth and performance that also impact their welfare and their experience of pain. So I think that's a real positive from calves, people who work with them, and for ultimately our consumers too. So I'll pass it over to Dave.
Yeah, I think the key kind of takeaways from mine is probably not surprising. I think that many of you probably know that diarrhea is quite costly and has a big impact. And I think it's shown pretty conclusively through the work we've done at Guelph, but also other places, kind of the impact that has. I think the other kind of takeaway is that it's more than just pathogen exposure. There's certain things that you're doing around the time of birth in particular that are creating kind of microbial environment or certain bacteria that are going to increase the likelihood of development of diarrhea. And then I think, like similar to what Mike had presented earlier on, colostrum management is really, really important, but there's lots of other things that kind of go into that, including cleanliness of the environment, maybe using some transition milk or some type of probiotics or prebiotics can certainly influence gut health. And then finally, I think the final takeaway from my presentation is that you can use colostrum as a potential therapy for diarrhea, and having a 50% milk replacer, 50% colostrum replacer mix, we found to be quite effective at reducing the length of a diarrhea bout.
Okay, great, thank you. So to start with our questions from our attendees, Caitlin from Packingham would like to know if 22% Brix is still the recommended minimum for colostrum quality.
I'll start that one, and thanks, Caitlin, for the question. I think 22 is your minimum standard. You should be striving for even higher, in my opinion, but 22 Brix would be your minimum. And just to translate that, that's between 50 and 60 grams per liter of IgG. Now that, assumes that you're feeding 10% of body weight, which is enough, but we have data that supports perhaps we should be even going higher than 150 gram to 200 gram of IgG being delivered in the first 12 hours of life. I think that we can even some cases double that and have better results, especially with the new Lombard recommendations. So that's my take on it. But also, I think if you don't have that high quality colostrum, you can enrich it with a dried colostrum source. And also, I think you should be feeding another high quality meal in that, at that 12-hour mark, because the gut is still appears to be open based on some data that we have. So you can still boost IgG in serum. But I'm not sure if the others have any comments. That's my nutritional standpoint on it.
I don't have much to add, Mike. I think 22%, feeding over 22% is really the gold standard. And the nice thing is you can do that on farm, get a Brewster factometer. They're really, really cheap. Get them on Amazon, order to your house. And yeah, pretty cheap way to make sure you're feeding high quality colostrum to cows.
Great.
Okay, so next we have a question from Valerie. So let's say your colostrum quality isn't there, or there's some other issue, and your calf does end up with low or failed passive transfer immunoglobulins. What can you do to then reduce the chance of having a poor performance?
Yeah, that's a great question. I think I'm going to give it to Dave and Charlotte to start, because I think we should be looking at this question a little bit differently first. But Dave and Charlotte, you go ahead.
Yeah, go ahead, Charlotte.
Yeah, no, I think it's a good question, and definitely a question that we get quite a bit. One of the challenges is the use of total proteins, and like what Mike was showing in the graph of kind of how accurate total proteins are at predicting what their actual immunoglobulins are. It's a good test. It's really useful, but I guess the main utility of it is to assess at the group level. So to see how your program is going for a group of calves. An individual calf, there is a probability that an individual calf can be mischaracterized. But overall, the idea is that you have a pass rate, 90% pass rate, so that you can say that, the colostrum program is going well on your farm, as opposed to making individual calf decisions. Although, yeah, I'll pass it over to Dave if he wants to add anything there on the either side.
Yeah, I totally agree with what you're saying, Charlotte. I think we don't really have a good answer. I think what you should do if you don't have a calf with failed transfer pass immunity, I think the key is really to ensure that you're getting the pass and measuring it on your farm. I think that's really, really critical. But definitely a little bit more work needs to be done in that area in terms of what you can do with that calf. Maybe you feed it transition milk for an extended period of time. Maybe you do some other type of intervention, but I think we don't really have a good answer at this point for that.
Yeah, I totally agree with Dave and Charlotte. We don't have an answer of what to do with these calves right now, other than, attempting these higher planes of nutrition and feeding more bioactives to these animals. But I really am excited by this area, because I think we should be feeding calves on more individual level, especially with all the automation that's being implemented throughout the world, but especially here in Canada. So yeah, great question, Valerie.
Okay, so continuing on, we have a question from Nancy, who's from Newfoundland, on what treatments or vaccines would you guys recommend for newborns or the pre-weaning period?
I got one. I'm just going to say I'm a nutritionist, so I'm going to defer to the vets for this. And I think that's what we should all do. So
yeah, I think when you're thinking about this stuff on your individual farm, I think it's important to have a discussion with your vet, because they know your herd best. They know kind of the pathogens that are there, or the risk factors that are there. Just kind of blanket statements, I guess. I'll make a couple of them. I think, obviously the colostrum is pretty important, and Mike spent his whole presentation talking about that. And I think he could have spent another day probably speaking about the importance of it. So that's important. I think there's also kind of some vaccines you can give, especially for respiratory disease. So intranasal vaccines that you just give into the nose, and those provide kind of localized protection against certain pathogens, respiratory causing pathogens. Yeah, you can also vaccinate your dry cows and get some better protection in the colostrum, even for rotavirus and coronavirus and E. coli. But yeah, I think probably talking with your vet and generating some more specific recommendations would be useful.
Great.
Okay. We also received a lot of questions on record keeping. So I'm just going to choose one here from Carrie. What things do you guys wish were recorded on every single calf?
I'll start with this one. I think we should be recording body weights and average daily gain on every single calf. And if I know that's difficult for a lot of farms to do. They're currently not doing that. Less than 5% of farms that I know of do it. But if time's critical, I would weigh them at birth and at weaning. If you can sneak in another measurement at 4 weeks, I think that's also a good indicator, because there's lots of diarrhea that happens during that time. And that's predominantly the milk feeding time when they're not consuming enough starter to get growth. So, that's an investment of 3 minutes I'm asking for every single farmer to do, to weigh their animals at 3 time points, or if that's too much, 2 time points. And I'll do anything for a farmer to do that. I will come and help you. Okay. If you're close by, I will help you just to get this set up, because it's really hard to make recommendations, at least from a growth and nutrition standpoint, if you don't know your average daily gain. So that's all I have to say, but I'm sure there's plenty of things that Charlotte and Dave will add to this list other than average daily gains.
Sure. Yeah, and I'll just add, I mean, I think for sure one of the challenges with record keeping is finding a way to make it something that's easy to do. And actually was just talking to a group of sheep producers recently who were using Google Sheets and then talking into their phone to do like an audio transcription that was quite accurate. So I'm sure kind of as technology gets better and better, there's going to hopefully be like easier ways where we can capture a lot of this data. I think for sure on the health side, for sure mortality information, really great if we had that more consistently for all farms, and certainly on the health side, treatments, and hopefully in a way that is, I think lots of farms have very good treatment records that are more on the temporary side that are useful for people looking after calves at that time, but having a way to archive them, that they're available to be able to use all that data on the farm to really look at trends.
I don't have too much to add. I think, like Charlotte was saying, I think having the records so you can look back on is really important, because if you don't have the records, you can't see how you're doing, you can't tell how you're performing, and it's really hard to make changes if you don't really understand where you're at. So I think recording, mortality and treatments and like Mike said, growth are pretty interesting things to do, and you can make kind of actionable management changes based on that data.
Yeah, now you can put it into your herd software pretty easily. So I think that's a really good thing for everyone to do.
Cool. So moving into health a little bit here. Kevin from Washington wants to know, what are realistic goals for calf pneumonia and diarrhea incidents in your herd?
If you want me to take this, Charlotte, maybe I'll start and Charlotte can finish it. I think honestly it's difficult. I think everyone has a different starting point. I think, like we said in the previous one, just recording information like diarrhea treatments and pneumonia treatments and mortality, I think that can give you a good insight to where you're at on the herd, and make your own kind of decisions based on the data that you have and where you currently are, and if you're happy with that. For industry benchmarks, there's a organization in the US, Dairy Calf and Heifer Association, that has their kind of gold standards. And I think for them, it's like less than 15% of calves are treated for diarrhea in the pre-wean period, and less than 10% of calves are treated for pneumonia in the pre-wean period, kind of being their kind of optimal goals for management.
Yeah,
Okay.
I don't have much to add other than I know herds that have very low mortality and morbidity. So it is possible to have like less than 5%. But that's very rare, but they are out there.
Okay, continuing with this health section here, how would you guys recommend keeping diarrhea incidences low?
I can start again. I guess I had a bit of a takeaway message on one of my slides about it, where it really starts with colostrum, making sure you're getting a lot of colostrum into these calves. I think there's a recent meta-analysis, or maybe this was a few years ago, but if you have failed transfer of past immunity, you're about 1.5 times more likely to have diarrhea, or the calf is 1.5 times more likely to have diarrhea. So colostrum management is really a pillar and an absolute baseline to success. And then from there, high level of nutrition. Charlotte talked about it in terms of wound healing and the benefits of that, but making sure that you're getting calves on a good plane of nutrition. 8 liters of milk a day is probably a good baseline. And then environmental cleanliness is also really important. Making sure that everything is clean and dry when you're moving calves in is another good criteria to think about.
Yeah, I'm such a nutritionist, but I must admit, I think the environment plays such a huge role in this, and the cleanliness. You can feed lots of colostrum, lots of milk. If your pens are dirty, they're going to get diarrhea. So I think that's, and also the ventilation, I think, plays a really key role. But it hurts me to say that as a nutritionist, because I just want to say that it's all nutrition, but it's truly not.
Okay, so when we do get that diarrhea, how do you identify what calves need to be treated and what do you treat them with? Or how do you treat them?
Who wants to take that one? Charlotte, do you want to?
Oh, you can go ahead, Dave.
Okay. Yeah, so with diarrhea, I guess the key is I guess creating a case criteria of having a calf that it truly has diarrhea, and making sure that it's watery manure is really the key clinical sign that you're going to see. Things that you can identify even before calves start to have diarrhea is changes in their drinking behavior. We did some recent work kind of highlighting that if you're on, for example, an automated calf feeder, there's some signs that change before calves even become sick. Like they'll drop their milk intake. They'll drop the number of times they come to the feeder to get some milk. So I think you can look for those subtle changes in behavior, like decreasing milk consumption, decreasing drinking speed, or the rate that they're consuming the milk. And I think that can serve as a kind of indicator of, or a flag that maybe I should look at this calf and see what's going on. So I don't know if Mike or Charlotte have anything to add on for identification. Calves.
No. Yeah, I think just scoring them and keeping your eye on them, and then definitely not going straight to an antimicrobial is what I'd be recommending with respect to treatment, and making sure you're getting enough oral electrolytes into the animals. And make sure you're still feeding meals of milk in addition to that, to the electrolytes, and not mixing the electrolytes with the milk meal, okay? Like feeding it separately. And if you can, wait 2 to 4 hours after that milk has been fed to offer the electrolytes, so there's nothing funky happening in the abomasum of that calf. But that's the thing. I really get concerned when I see tubing of milk when you have diarrhea. Like, it doesn't, if you can do anything to avoid that. I know some circumstances it's kind of a last resort, but as soon as you see that, it's just not, I'm really skeptical. But just make sure you offer them the right oral electrolytes too, and offer them frequently. But Charlotte, do you have anything else that I'm missing?
Oh,
I'm just a simple nutritionist here, Charlotte.
I don't. So I guess the only thing I'll add to, is the electrolyte choice too, I think is important. And I mean, I think electrolytes are better than not giving electrolytes, but ideally electrolytes that don't have all the extra glucose in it are a little bit better from a rehydration standpoint. I know sometimes people like them because they've got like the additional energy source, but like strictly from a rehydration standpoint, the electrolytes that don't have all that extra glucose in it are preferred.
Okay. Another section that we had some questions on was housing. So Natalie from Dunvegan would like to know some thoughts on the benefits, pros, cons of grouping versus individual housing.
I'll take it from a nutritional standpoint. I think group housing is great so that the calves can learn from one another so that they can consume more starter. And I think it's wonderful from that standpoint. And all that work has been done at the University of British Columbia, really showcasing that. Now it's a part of our Pro Action program here in Canada. So I like group housing from an educational standpoint from the calves, so they can learn from one another, eat more starter, have better weanings. So I think it's great. And if you can't do it, I think pairing calf hutches is a good approach. or if you're rebuilding in the future, to consider group housing at least 3 weeks on. Anyways, that's all I have to say about group housing versus individual housing in your facilities. Dave or Charlotte, you want to take this on? Group housing versus individual?
Sure. Yeah, I'll just echo that. Yeah, definitely. There's been work with the paired housing showing benefits there. So sometimes if that's a more practical option, or I mean, one of the big challenges for sure is disease transfer, right, in groups, and that's can be more of a concern on some farms than others, and sometimes it can be a really big challenge. So in some cases, pair housing, certainly you can get that social facilitation and benefits there that really persist. I think we don't even know how long those benefits persist out in the calves, but it's been shown to affect their behavior in many different ways quite long term. So pair housing is certainly a good option, and I guess the other thing too is and again, it's, I think, an individual farm decision for sure. But if you're struggling with health issues in certain groups, certainly some farms find, having individual housing for a certain period of time, if early life is challenging, and then putting them in pairs or groups as they're a bit older, certainly you can still get social benefits. It's not kind of an all or nothing scenario. So, finding ways to make it work on your farm where health is still maintained for sure.
Yeah, on that note, I think there's a big misconception, and maybe Dave can talk about that the calves in group housing are not as healthy. And I don't think that there's good evidence to support that notion. But what do you think?
I think it depends on group size. And actually, Dr. Godden had a comment in the Q&A about large group sizes actually being a negative for calf health. So keeping group size probably less than 8, maybe anywhere between, pair housing all the way up to 8 calves is probably good. If you have really, really large group sizes, I think that's where you get into trouble with increased levels of respiratory disease or diarrhea in some circumstances. So I think group housing is really, really good. Lots of benefits from the welfare side, but retaining group size, moderate group size, maximum of 8 is probably where you want to draw the line.
Yeah. I definitely don't like to see 20 calves on one feeder in an automated system, but you do see that frequently on farms.
Okay, moving to nutrition. Describe your ideal feeding program from birth until the first month of life.
I'll take that one. So I think that we should feed as much colostrum as possible of the highest quality. So I'm saying 22 is your minimum. If you can get it higher, that's better. And I would feed at least 2 meals of that really high quality colostrum. I would then implement a transition program from this colostrum to whole milk. If there's no transport involved in that first week of life, I think that you can actually increase milk feeding rates using an automated feeder or even feeding manually up to high levels. And I'm saying high levels over 1.2 kg of intake of dried milk powder or whole milk per day. So that's equivalent to about 8 to 9 liters, I think is totally feasible to actually feed a calf in the first weeks of life. So it can be done manually or automated. So that's how I take a calf to 0 to 4 weeks. Do you agree with me, Dave and Charlotte? Am I missing something? You guys always catch me when I'm missing something. So now's your time.
No, I agree. I think I would do that. I think that sounds like a gold standard feeding program, Mike.
Thanks, Dave. Getting a thumbs up from Charlotte. I feel good about that answer now. Thank you.
Okay, let's see if you can answer this one as well. How about weaning?
Yeah, I love weaning, so I'm going to take this one. I used to study weaning all the time, and I just am fascinated by feeding higher milk levels and in this notion that you can't wean calves very well. So what I would be doing is I would wean after 8 weeks of life. If you're feeding higher levels of milk, I would have multiple step downs, not just one abrupt step down, but multiple step downs. Even if you're feeding manually, you can still have multiple steps and you'll have success if you do that. But I would have a minimum of a 2-week step down there. So ideally, I'd like to have them weaned completely off milk by 8 to 9 weeks under those scenarios, just to make sure that their average daily gains, and you should be weighing them again, even at this weaning period, Weaning success can be really truly determined on average daily gain post-weaning, and it should be over 1 kilo. I think that's a really good standard to achieve. That means your weaning success is great. So that's how I do it. I'd also keep your eye on starter composition too. Didn't talk so much in my presentation about that, but if you're feeding high levels of milk and you're weaning them, I'd be a little bit concerned with high starch levels, like above 30%. And that's quite common in starters, okay? I'm just a little bit concerned that that can affect gut health. And also making sure that there's a lot of starter, either ad libitum starter or a dry TMR with a really high concentrate above 85% during this weaning period. Yeah, so that's my answer for weaning. Anything you want to add, Dave and Charlotte?
I agree, Mike.
Wow, this is really
hard
easy.
to go against an expert like you.
Oh, thanks, Dave.
All right, continuing with our nutrition, we had a lot of questions about fiber source. So would you include a hay or a straw or another fiber source? And at what age do you include this in the diet?
Yeah, I think from the first week of life, you should be providing a clean fiber source, being a chopped hay or a chopped straw. I think both work. I think a lot of people argue about forage sources, but we're looking at something less than 10% of their intake. So to me, that doesn't really make a lot of sense from a nutritional standpoint. I see it making very little difference actually, but I think as long as it's chopped, which is important because that will increase their overall intake, and there's a clean source, we know they're going to be eating their bedding. If you open up a calf, there's bedding everywhere, but I think just getting them used to having a clean source of forage is a really good idea. So even from the first weeks of life. Yeah. So I have no preference on the type of forage actually. Whew, those are good nutrition questions, Hannah. Thank you.
Okay, moving to welfare. Is there a way to translate welfare studies into economic measures to estimate how much we are losing by ignoring some aspects of animal welfare? And that is a question from Ben from Guelph.
Okay, sure. Yeah, I think that's a good question, and there's not a simple answer, but I'll keep it short. So in a lot of the studies, like specifically for just bedding pain control, but I mean, it can be translated to other aspects of welfare too, in that research. Like certainly there are some studies that, find a benefit in average daily gain or, maybe in health, but kind of summarizing all the literature, it's a bit here and there. So some studies might find performance benefits, some studies might not. I mean, not everybody's looking at the same metric. But to me, at least, what the kind of take home is that it's probably highly dependent on the farm, just because there's so many differences with how calves are raised. In all these studies, calves are on different nutritional planes. They're being weaned at different times. They have different housing and different management. So I think it just makes sense that, if we do things that decrease stress, that can have a performance benefit, but maybe on a farm where everything is going really great, you're not going to see big differences. But maybe on another farm where they're really on an edge, maybe you will see differences in health. And one of the other issues is most of these studies aren't designed to look at, those economic benefits, and you probably need a lot more calves. That's from an individual animal standpoint, just because a lot of these procedures are early in life. And I think there are big well-being benefits from, the weeks following those procedures, but to kind of say, okay, how does that translate into first lactation milk production? That's a bit iffy. But on the economic side, I think, especially for things, like pain control, I think the economic benefits aren't in the individual calf, they're in the industry level. So it's about, managing calves in a way that we can sell a product to consumers. And I think, certainly we want to make sure, I think from a scientific perspective, that at least, we want answers that are accurate and answers that tell us what is actually meaningful to the calf and is going to be a meaningful difference on well-being. But I think the economic argument is probably much stronger on an industry side, as opposed to an individual animal side, especially with procedures that are really early in life.
Yeah, I totally agree with you, Charlotte, that this is more of an industry level response that could affect how consumers drink milk in the future. So I think that's really critical. We need to keep our eyes on everything like that.
Okay, a question from Ralph. Does it pay to raise your bull calves, and to what age?
I'm going to defer to Dave first. Yeah.
Yeah, I think that's a tough one. I don't know if I have a great answer. I think it depends where you're going to market your calves. Like if you have a good outlet for the calves, so if you raise them yourself to, let's say, weaning, and then you have a place where they can go afterwards, I think then, yeah, that makes sense, where you can have a good outlet, you're getting paid a decent price for those calves out the door. Yeah, I think it really depends on having a good outlet, to be honest. But yeah, sorry, I don't have more insight into that. I don't know if Mike or Charlotte have more insight into that.
Yeah, I want to encourage farmers to consider rearing their bulls more. I have friends that do it in small herds on less than 100 cows, and they supplement their milk check with, they can make up to $1,000 per animal if they market directly to a large packer. And that's without selling directly to the consumer. So I think that there's money in it at every scale. We also have examples of larger farms, actually family farms, that have taken into the dairy beef sector in a big way. And yeah, I think that there's a lot of economics there. So even on a small scale, I would consider this as a future option to supplement income. But the big question for us and what we're interested in is transport. And, it would be great if we reared animals until after they're weaned under a traditional system, and if in a perfect world too. But if that means overcrowding at your farm with heifers and bulls, I think that can backfire on you. But I think that you should consider, if you have the facilities, actually rearing them up to weaning and selling them for a lot more money post-wean. And obviously there's the animal welfare benefit to that, as well as you're not transporting pre-wean calves, which I think is a big issue in our industry.
Okay. So a question that's getting a bit of attention in the chat is, if you're feeding a large quantity of colostrum at birth, and you're suggesting to feed another meal at 12 hours, what if your calf doesn't want to drink? Is it worth it to tube the calf?
Yeah, so I would, if it's really high quality colostrum and it's not suckling in that first meal in the first hours of life, that's really rare actually, but then I would tube it. Then I would go back to that calf again before 12 hours and try to offer it with another bottle. If it doesn't work, I would be a little bit hesitant to tube it, but I'd make sure that you're well over that 200 grams of IgG in that first meal. However, I think that's quite rare to see. I think most calves will suckle well over 10% of their body weight in the first 12 hours. So my recommendation would be to try to even get more, especially if they're suckling from a bottle. Feed as much as they'll consume, in my opinion. Now, I'm not sure if that really agrees with what Dave and Charlotte think. But also another piece of data before I let Dave and Charlotte chime in here is surprisingly, there wasn't a lot of difference when we did a study versus tube versus bottle feeding colostrum. So the biggest point here is, if they're not suckling, please get the colostrum into them with a tube as soon as possible. But I think you might be surprised that most calves will consume well over 10% of their body weight through suckling in the first 12 hours of life.
Yeah, I think what Mike said is fair. I think ensuring that you're getting a good amount of colostrum into the calf in the first feeding is really, really critical. That's really the most important one. And then for the second feeding, I think that's also important. And there's some studies showing that if you have 2 feedings of colostrum versus just a single feeding of colostrum, that can go towards potentially preventing diarrhea. So having 2 feedings is much better than just 1. But if you're at the second feeding and you've already fed enough at the first one, maybe 2 feeding that calf might not be the best thing to consider. And maybe you wait a little bit and be a little bit patient and try and feed it with a bottle later on.
Okay, there are still plenty of questions left, but we are nearly out of time here. We will be posting a video on YouTube later on that will be sent out through email answering all the remaining questions. So no worries if your question hasn't been touched on yet. I would like to thank Mike, Dave, and Charlotte for speaking to us today. And thank you to everyone attending. I'm going to pass this back to Sabina for our door prizes.
Thank you, Hannah, for facilitating such a great discussion there. Once more, I'd like to thank our wonderful speakers for sharing their knowledge and research with us today. To all the members of the Advanced Dairy Management class, thank you again for all your hard work in planning this event. And last, but certainly not least, I'd like to thank every one of our guests today for tuning into this webinar, asking such great questions, and overall helping make it such a great success. And so to show our appreciation, we'll be spinning a virtual wheel to randomly choose 3 participants that will win their very own crochet cow. So as a little demonstration, I have one of them right here. So they are handmade locally with all those little good details. And if you open up the back, there is a little calf there as well. So it's a great demonstrating material for teaching or just to have around. I have one on my desk at home. So to start our prize wheel, here we go. So we have all the 600 people registered here on the wheel, and let's see who's a winner. Okay, so the first winner we have is Emily Napper. Okay, and then Ruben Gregoret. And our last winner today. Trevor DeVries, my master supervisor, so congratulations. So all of those winners will be emailed, and we'll be asking for your address to send your crochet cow, so get excited for that. And before we end things today, I'd like to thank everyone again for their support in making the second Trifecta webinar so successful. So we hope you enjoyed it and learned something new, and stay tuned for the possibility of next year's webinar. So thanks everyone again, and have a great rest of your day.